Hi, it's Dr. Noel Williams, Optimal Health Associates, August 19th, 2021. Big shout out to my son Noel, the dentist, who's 31 today. Happy birthday, Noel. So COVID is about Delta now. So we're going to talk about Delta. Delta has two qualities that are very important to remember. At the tip of the spike protein, there's an alteration in the genomic sequence, and that makes it more sticky. Secondarily, since it's more sticky or more infectious, and there's an alteration, the antibodies generated from prior infections and all the current vaccines don't line up quite as well. So that's an issue. The other thing that happens is it replicates much faster, 23,500% faster, so you can get sicker or get a bigger viral load faster, which in turn can make you sicker. So if you've been vaccinated or you've had a prior infection, your baseline immunity is probably somewhere, from reading all the different data, of about 35%. Your baseline asymptomatic infection rate is about 35%. Your baseline symptomatic rate is probably about 30%, and about 1%, I know that goes over, but 1% of people get seriously ill. So the bottom line is this: if you've been vaccinated, you have a 99% reduction in severe, or you only have a 1% chance of severe disease. And it looks about the same for prior infected. So what does that mean in real terms? So if we look at getting a COVID infection, you have a 30% chance of getting lung damage with a mild infection, or even a mildly, or just almost an asymptomatic infection. You have a 20% chance of getting severe disease, potentially, and this is really appropriate to remember with Delta, even at a younger age. And third, about 2% of people die. And it's not just people with comorbidities, okay? It's not. Get that out of your head. I hear that every day, and sometimes I want to just shake the people. No. We had a 24-year-old with no comorbidities die in Oklahoma City this morning. We have a 13-year-old child in one of the hospitals on a ventilator who's severely critically ill in Oklahoma City. We have a 26-year-old who's severely critically ill on a ventilator and not doing well in Oklahoma City with no comorbidities. Now, the 13-year-old does have some, but the point is people can get really sick. So if you look at it with about a 2% death rate, a 20% severe illness rate, and then within the other group, a 30% chance of having some long-term lung damage, about 50% of people who get COVID have the potential for long-term damage or death. Now, the death's small, but it's still there. And so if you can lower that from 50% to 1% risk for severe illness or long-haul syndrome or any of that stuff, you have a 5,000% reduction in disease event. It's 5,000% by doing the vaccine. That's why it's worthwhile to do the vaccine. But I can explain that, other people can. I have a couple colleagues who have been very friendly and advised me that they think I've made some mistakes by encouraging vaccination. They think people are going to be really sick eventually. And I'm doing the best I can, because I look at these people with someone like me, where I have if I get COVID, I have a 50% chance potentially of having a significant event that's going to shorten my life, versus a 1% chance. I wanted the 1% chance. I like that better. But that's me, but that's what you have to understand. Plus, our healthcare system kind of needs it. Otherwise, it's going to go kaplunk. The problem we're having, though, and I'm having, and I want to be very clear about this, is I have never been for pediatric vaccination. I've never been for it. I think it's been completely overblown and not useful. The issue now is Delta is affecting more kids. And that volume of kids, some of them are getting really sick. And I can't put my finger on the data as to whether or not it's significant enough to get the vaccine, but I also can't tell you it's significant enough to not get or it's insignificant enough to not get the vaccine. I've been very comfortable on that subject until now, but Delta is changing it. I don't care if the biggest reason the FDA has wanted kids to get it is to transmission to unvaccinated adults. That's baloney. I don't care if you make the choice not to get vaccinated as an adult and you get it, that's your choice. Putting kids at risk with a vaccine when they're weren't going to get sick from the virus never has made sense to me. The problem is we are starting to see an uptick with kids, and the data has gotten so confusing because we have a total failure to record accurate data on a national level, and any data that comes out that doesn't meet narratives gets thrown away, whereas other things get added, and so it becomes very, very confusing. But I can tell you there is definitely an increase in illness now that we're 4 weeks in with kids, mid-teens, 13, 14, 15, 16. So I don't feel comfortable recommending against the vaccine for them. And I'm starting to feel more comfortable saying you need to really think about it and you need to watch it and make a decision. And I'm sorry about that, but it is too confusing for me to be able to say, don't do it anymore. And I'm sorry, it's just, I can't get good data, and I think there's probably some benefit for some of these kids because some of them are going to get sick. And I wish that wasn't the case, but Delta is a different beast. So while some people will be frustrated with me for saying I think it's time to really strongly consider mid-teen vaccination, there'll be other people mad at me for not saying you needed it right away. Well, there still is not sufficient data to be able to say either direction, but it's starting to trend a little bit from what I'm reading that kids are getting sicker. And so we have to start thinking about, 14, 15, 16 kids getting vaccinated. I think 18, 19, 20 is pretty clear now, and anyone over 21 for sure. But I mean, we're seeing kids dipping, or youngsters dipping into the low 20s getting really, really sick. We really have to get these kids over 18 to 21 vaccinated. And I know there's questions about fertility. It is not scientifically documented that yet. If it was documented and we could prove that it caused infertility, I would have a different comment. I do not, there's no data proving it at all. Number two, I want to be clear. I understand vaccines have risks. The COVID vaccine has absolutely positively killed people. There is no question in my mind about that. However, when you look at a level of disease diminishment for at-risk people, it is the balance. And that's one thing I can tell you versus maybe the FDA, who acts like it's harmless, but there's risk to it for adults. There is small risk for kids with cardiovascular stuff and blood clot. There's risk. But there's risk to COVID too now that's starting to look like it's significant to kids too, and so you have to start balancing those risks. So this is tough stuff. And I wish there was a way to get around it and say, you all just need to do this, but I can't do that because the data is not clear to me, and I don't think it's clear to anyone. The third thing is the booster. The booster is probably the single most meaningless and potentially harmful direction the federal government's given yet on COVID. The whole problem with Delta is it's different antigenically. So you still get a 99% reduction in serious disease events, but giving you more of the same thing isn't going to get you past 99%. It's just not going to, because it misses the vaccine. It's a great vaccine in terms of what we wanted it to do, which is to prevent serious illness and death. But we're not going to, by giving more of it, it doesn't get better because you're getting the same antigens or proteins. And so you need a new vaccine that accounts for the antigenic change with Delta and the Delta subvariants. So getting another vaccine If you're not immunocompromised or immunocompromised when you got the original vaccines, doesn't make any sense. What is going to happen is you are going to potentially have a strong reaction to it occasionally. I don't know who those people will be. Some of those people will get blood clots. Some of those people will have heart attacks. Some of those people will have some very significant side effects from the booster, which they didn't need in the first place. So if you are immunocompromised and you've had your antibodies checked and they're scant to none, which I have detected now in 2 people recently, yes, getting the booster makes sense. In both of my patients' cases, they had messenger RNA vaccines, so we're going to have them do the J&J this time to see if we get a different result, just to try something different. But that's how it is. But if you have an antibody level and you have normal health, getting another vaccine is not going to be meaningful. This whimsical and arbitrary 8-month thing I don't think matters. But again, that's against the narrative. There's lots of people getting sick now who've been vaccinated. We also now are having people, we've had 3 people in the last few days who had been infected, positive antibodies, got the vaccine series done, and now have gotten infected. And they were supposed to never get infected, that combination. But it just illustrates again that even with infection and vaccine combined, the Delta is going to give mild illness. And so think, if you haven't gotten infection or vaccinated and you get Delta, you may get major illness, even if you're young. So that's really what I want to finish with, is vaccines are very important. This is the one thing we have besides outpatient therapy, which again, the FDA is vehemently against, as are many physicians in this country, unfortunately. So that's the kind of the rub tonight. Sorry I can't be clearer in terms of direction. I'm trying to do the best I can, but it is a tough, difficult situation we're in. We're trying to figure out what to do with kids. Anything else, Kim?
No, most of the questions were about the booster.
The booster I just think is silly. I mean, it just isn't, I won't comment too strongly. I mean, at one hand, people are criticized, sometimes say, I'm too pro-vaccine, when I'm really, it's a measured response to a disease as an intervention, and it's the best intervention we have besides treatment, outpatient, but since that hasn't been adopted, we have to recommend the vaccine for the general population. The boosters just don't make sense to me to a normal person. I think they could cause tremendous harm.
Good.
That's it. Thank you. Good night.